Libitight gel. Libitight gel is a femigel gel for female. From its name, it works in libido, tightening, and moisturizing. Tightening and moisturizing and libido.
And restoring.
Let's discuss. Okay. Libitight indications. When we use Libitight, we use it on vaginal dryness, in dyspareunia, which is painful intercourse, post-menopausal vaginal atrophy, and it provides tightening effect and increased sexual libido.
Okay.
This is the indications of our product. Let's discuss them. Vaginal dryness. First one, a woman's vaginal health is an important part of her overall health. Vaginal dryness may be a problem for women at any age. A decrease in estrogen secretions can have several negative effects on the body, one of which is inadequate lubrication of the vaginal walls, which leads to the vaginal dryness. This is extremely irritating and uncomfortable for a woman and can negatively impact the vaginal health by causing sores, painful intercourse, light bleeding, recurrent infections.
Okay.
Causes of vaginal dryness. While vaginal dryness is often associated with menopause, you know menopause, huh?
No, sir. No, sir.
Menopause, it is the period after the ministerial period is stopped. This is called menopause.
Okay,
menopause.
Okay.
Yeah.
It can be prompted by other causes at various ages. Vaginal dryness is
Okay.
often associated with menopause. It can be prompted by other causes at various ages. Perimenopause
Okay,
state, the period before menopause, means around menopause and refers to the time during which the body makes the natural transition to menopause. Chemotherapy or hormone therapy for cancer treatment also will cause vaginal dryness. Surgical removal of ovaries will cause vaginal dryness. Childbirth and breastfeeding will also cause vaginal dryness. All of these can cause vaginal dryness. The most important one is menopause and perimenopause. Okay. Some medications, allergy or cold medication or anti-estrogen medication, also can cause vaginal dryness. Immunodiseases can cause vaginal dryness. A frequent thing, using vaginal douche frequently. This will disrupt the vagina's chemical and biological balance and can cause inflammation.
Right.
Why vaginal dryness can be caused during menopause? This is the period before 50s, or 30s, or 20s, or let's say 40s, before menopause. We have a high percentage of estrogen. Estrogen works like a moisturizer for the vagina. When menopause, when female reach the menopause, the estrogen level will be lower. And this will cause vaginal dryness. Okay. Low estrogen levels, thin vaginal tissues, low vaginal lubrication, inflammation, dryness, due to low estrogen levels. And this is caused by menopause. Okay. The severity of vaginal dryness may vary from woman to woman, but nonetheless, it is commonly irritating and uncomfortable and can significantly impact women's quality of life. Vaginal dryness may be accompanied by itching or burning within the vaginal area, pain or light bleeding with sexual intercourse, recurrent urinary tract infections, and urinary frequency or urgency.
Okay.
Okay. We are completed talking about vaginal dryness. We will talk now about something called dyspareunia. Dyspareunia. Dyspareunia.
Really.
What is dyspareunia? It is dyspareunia. Chronic, recurrent genital pain experienced just before, during, or after sexual intercourse.
Okay.
It is painful intercourse. In summary,
So
it is a painful intercourse.
So once more.
Painful.
Okay. Painful. Okay.
Pain experienced just before, during, or after sexual intercourse.
Okay.
58% of women avoided intimacy due to vaginal discomfort. 64% of women experienced loss of libido due to vaginal discomfort. 64% of women experience pain associated with sex. This is called dyspareunia. Dyspareunia. About 30% of men and women claim they ceased having sex altogether due to vaginal discomfort. In summary, it is a vaginal discomfort during intercourse. It is a common. You may notice 58%, 64%, 64%. It is a common.
Okay.
Dyspareunia symptoms. What are the symptoms of dyspareunia? Dryness, vaginal secretions burn, persistent irritation, burning, and pain, recurrent interactable vaginal infections. It may cause some vaginal infections, especially candida albicans. Candiosis is a fungal infections. Inability to tolerate speculum exams. Speculum exams, it is exams done by doctors for the vaginal on the vaginal area. Even the female will not tolerate the speculum exams. Painful penetration during intercourse. Pelvic floor spasm. Decreased sex drive. Dysmenorrhea. What's the meaning of dysmenorrhea? Full menstruation. Painful menstruation.
Painful.
And a lot of urologic symptoms within the urinary system. Okay. We are talking about dyspareunia symptoms and dyspareunia itself. Let's talk about something called postmenopausal vaginal atrophy. Postmenopausal. After menopause, the vagina will cause some atrophy. Atrophy means atrophy, shrinking or shrinkage. The vagina area will be shrink. This is called vaginal atrophy.
Okay.
If we compare the vaginal area, perimenopausal and postmenopausal, we will see it here. we will say it elastic tissue. Why?
Okay, sir.
Postmenopausal tissue, it will loss of folds, loss of inner lining and the glandular function, and may cause vaginal atrophy. Vaginal atrophy. This is called vaginal atrophy. And this is done after postmenopausal. Okay. The thinning of the walls of the vagina caused by decreased estrogen levels. Also, this is caused by decreasing estrogen levels. Most commonly occurs after menopause. Menopause is usually between age to 45 to 55, when the woman's ovaries no longer release eggs. In some women, symptoms occur during perimenopause or the years leading up to menopause. In other women, symptoms may not appear until years later, if ever. May some people, may some female complain from postmenopausal vaginal atrophy, and other may not complain. Okay. The symptoms include thinning of the vaginal walls, shortening of the vaginal canal, lack of vaginal moisture, vaginal dryness, vaginal burning, discomfort or pain during intercourse, which we called it dyspareunia, pain or burning with urination.
Okay.
This is the symptoms of vaginal atrophy. How Libitight can be useful for vaginal dryness and dyspareunia and postmenopausal vaginal atrophy. In our product, we have 0.5% hyaluronic acid, low molecular weight with deep hydration properties. Hyaluronic acid, 0.5%. One of the most properties of low molecular weight hyaluronic acid is locking the moisture effectively within the tissue. It will prevent moisture from escaping from the tissue. The moisture will be locked within the tissue. Hyaluronic acid play an important role in the healing and hydrating of the tissue. In fact, these molecules are able to absorb up to 1,000 times their own weight in water. It will absorb 1,000 times of their weight of water and lock the water within the tissue. So it will cause hydration, deep hydration process. This will prevent vaginal dryness, dyspareunia, and postmenopausal vaginal atrophy, because it will keep moisture within the area. Here, a clinical study about hyaluronic acid, evaluation and the efficacy and safety of hyaluronic acid vaginal gel to ease vaginal dryness. You can enter this to this clinical study and find its conclusion. Its conclusion that hyaluronic acid is effectively used for vaginal dryness. Also, hyaluronic acid in postmenopausal vaginal atrophy, another study. You can enter it by yourself and see the conclusion. Also, another clinical study, postmenopausal vulvovaginal atrophy is positively improved by topical hyaluronic acid application. Comparison of hyaluronic acid vaginal cream and conjugated estrogen used in treatment of vaginal atrophy of menopause women. We have at least 100 papers that discuss the effectiveness of hyaluronic acid for vaginal dryness and dyspareunia and postmenopausal vaginal atrophy. Also, in our product, we have chamomile extract. We discussed that we have hyaluronic acid, also we have chamomile extract. Chamomile extract 1.5%. And this is chamomile, you know chamomile.
What, sir?
Chamomile, you know it? It is a flower
No, sir.
used to treat the irritation of the skin, and it's moisturizing. It contains, because chamomile contain high amount of ibizinin and the glycine flavonoids, and these flavonoids has the same phytoestrogenic effects. So it will have effect on dyspareunia and sexual satisfaction in postmenopausal men. We have here another study that discuss the influence of chamomile vaginal gel. In our product, we have hyaluronic acid and vaginal gel. And both of them are working on vaginal dryness and dyspareunia and postmenopausal vaginal atrophy. Also, in our product, we have ingredients that cause vaginal tightening. Vaginal tightening refers to any method used to tighten the vagina, which can lose muscle tone and become lax after childbirth or menopause or due to the age. Vaginal tightening has also the following benefits: improve symptoms of the vaginal atrophy, reduce the vaginal dryness, it treats stress urinary incontinence, improve lubrication, reduce the number of recurrent infections such as bacterial vaginosis, improve vaginal laxity, increases sexual pleasure. This is all the benefits of vaginal tightening. Method, we have many methods of treating vaginal tightening, but the most important one, using potassium alum. Potassium alum. In our product, we have potassium alum in 1.5%. This is in Libitight. Considered safe by the FDA, and its use in homeopathic or ETC products. Main indication for the use of potassium alum is cosmetic, astringent. It works as astringent and tightening of the skin, a shrinkage of the tissue, tightening of the skin. The effect is temporarily, not permanent, and lasts for 30 to 6 minutes. The once of action needs to 1 to 30 minutes after application. 1 to 30 minutes after application, the tightening effect will be noticed. Also, we have a material called allantoin, 1.2% in our product. Also, allantoin works as tightening effect, work as astringent and tightening effect. Allantoin is considered effective moisturizing, smoothing, and increase the elasticity and longevity of the skin. Okay. Relaxes cell tissue, aids the blood circulation around the genital areas. So it will, because its effect in blood circulation, it will increase the libido, and also it will increase the elasticity and the shrinking of the vaginal area. Also, we have L-arginine 2%. L-arginine works by increasing the blood flow in the genital area, which increases the libido and increases the sexual arousal and sexual satisfaction. So thanks to the potassium alum 1.5%, allantoin 1.2%, and arginine 2%, it will cause vaginal tightening and increasing the libido. So if we summarize the mechanism of action of our product, we have hyaluronic acid and chamomile extract. This is for vaginal dryness and dyspareunia and post-menopausal vaginal atrophy. Also, we have potassium alum and allantoin and arginine for vaginal tightening and increasing libido. Okay. If we make a comparisons between other products and Libitight, we have many products in the market, but you may notice that it may work only in vaginal dryness. Vaginal dryness, polygenelli vaginal ovules working in vaginal dryness because it contains hyaluronic acid and vitamin E. Also, Mastrilli Madame contains soybean and hyaluronic acid for vaginal dryness. Mastrilli C hyaluronic acid for vaginal dryness. Mastrilli Flora Plus, it contains hyaluronic acid with probiotics for vaginal dryness and restore normal flora. Hymen gel, it contains allantoin and chamomile and angastastase for tightening and increasing libido. But our product contains hyaluronic acid, so it will work on vaginal dryness. It contains chamomile, work for vaginal dryness. Allantoin, potassium alum, and arginine, it will tightening and increasing the libido.
Yes, sir.